Before detailing the various trigger point release methods, it's important to address a common technique that is used to relieve muscular ailments: muscle stretching. General muscle stretching is an ineffective technique for releasing trigger points. Muscle stretching, as it is typically applied, only serves to aggravate trigger point activity within a muscle group and is therefore to be avoided. However, there are several trigger point release techniques that employ muscle stretching effectively. All of these techniques utilize augmentation techniques that dramatically improve the clinical effectiveness of the stretch technique. Several of these specialized stretching techniques are detailed in this section. The spray and stretch trigger point release method was developed by Dr. Travell and involves applying a spray-on refrigerant as a surface anesthesia while stretching the muscle group containing the trigger points. The spray is directed on the skin region where a trigger point refers pain and serves to temporarily block or distract the perception of pain by the nervous system. The actual release of the trigger point is achieved with the muscle stretch, but it is the spray's blocking of the pain reflex that enables the stretch to be performed without complication. Spray and stretch is a very effective method for releasing trigger points, but its clinical application requires a great deal of skill and experience to be consistently effective. A trigger point release method often employed by physicians involves using a needle to physically break the microspasm of the trigger point. Often this technique includes injecting a very small amount of a local anesthetic into the trigger point. Dry needling uses a small needle without an injection to deactivate the trigger point. Injection and dry needling techniques are equally effective, but there is typically more post-treatment soreness associated with dry needling. Obviously, both of these release methods require a high degree of skill and extensive training. And as an invasive procedure, they carry risks not associated with manual release methods. Also known as ischemic compression, this widely utilized release technique involves applying specific manual pressure to release the contracted fibers of a trigger point. There are two effective variations of this method: the sustained pressure technique and the microstripping technique. The sustained pressure technique involves the therapist using a thumb, fingertip, or elbow as a contact on the trigger point and then slowly applying pressure, holding the pressure for 4 to 8 seconds, and then slowly releasing it. The therapist then repeats the pressure application 3 to 6 times. Which contact a therapist chooses to use, how long the pressure is held, and how many pressure applications are needed are primarily determined by the specific trigger point being released. The individual preferences and characteristics of both the client and the therapist may also help determine these factors as well. The microstripping release method, popularized by the work of Claire Davies, involves using a supported thumb contact or thumb over thumb to apply a short stripping stroke across the trigger point parallel with the muscle fibers. This technique is very effective at releasing the contracted fibers of the trigger point. To perform this technique, the therapist applies pressure to one side of the trigger point and then slowly moves that pressure through the trigger point to the other side. It's important to clarify that the contact never slides across the skin, as in traditional muscle stripping techniques, but rather the skin is moved across the underlying muscle. Typically, this technique is more effective in releasing trigger points that lie in the more superficial muscle groups. Employing a mixture of sustained pressure and microstripping release techniques can significantly reduce the therapist's fatigue. The advantages of using these pressure release techniques are: they are simple techniques that are easy to learn and apply, and the referred pain produced with these techniques confirms for the client that the therapist has located the source of their pain. The disadvantages of using these pressure release techniques are: these techniques are painful for the client and require the therapist to modulate their pressure to the pain tolerance of the client. And their application can be fatiguing for the therapist if proper biomechanics are not employed. A type of muscle stretching known as post-isometric relaxation, otherwise known as PIR, can be an effective trigger point release method. PIR was first introduced by Dr. Carl Levitz and is particularly suited for releasing trigger points in muscles that are difficult to address with pressure release techniques. The basic PIR method is as follows. Instead of directly stretching a muscle containing trigger points, a series of gentle isometric contractions are imposed upon the muscle at its full pain-free length. The relaxation that occurs after each contraction affords the muscle with some additional pain-free range of motion. The therapist passively stretches the muscle a little further between each contraction to capture this additional range of motion. The contract, relax, stretch cycle continues until the muscle progressively achieves a normal, pain-free range of motion. The clinical focus of PIR is on the relaxation phase of the cycle, and it employs several augmentation techniques such as coordinated breathing and eye movements to enhance the relaxation response of the muscle. The isometric contraction is limited to 10 to 20% of the client's contractile strength to avoid aggravating the trigger point. The application of this technique does require some technical skill on the part of the therapist, but as a somewhat pain-free method of trigger point release, it has real clinical value. A hybrid technique that we are developing, combining PIR with the coordinated application of pressure release techniques, has provided some remarkable clinical results in our daily practice. The use of ultrasound therapy in the treatment of trigger points is becoming more extensive. Though the mechanism is not completely understood, there have been some specific ultrasound protocols developed with promising clinical results. More research on this specific application of ultrasound is needed.